Hello, everyone. Bonjour à tous. Welcome and thank you for participating in today's technical briefing, which will provide Brigadier with an update on Canada's COVID-19 vaccine rollout. Bienvenue à la séance d'information technique pour donner une mise à jour sur la distribution des vaccins contre la COVID-19 au Canada. Today, we'll hear remarks from our Deputy Chief Public Health Officer, Dr. Howard Njoo, as well as our Vice President of Logistics and Operations, Brigadier-General Krista Brodie. They will be accompanied by Joelle Paquette from Public Services and Procurement Canada. Following the remarks, we will open the teleconference line for questions from the media. Aujourd'hui, nous entendrons les allocutions du sous-administrateur en chef de la Santé publique du Canada, Dr. Howard Njoo, et de la vice-présidente de la logistique et des opérations, Brigadier-General Krista Brodie. Ils seront accompagnés de Joelle Paquette de Services publics et approvisionnement Canada. Suite à la présentation, nous répondrons aux questions des médias. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, appuyez sur étoile 1. Procédons à la meilleure séance d'information technique. Let's begin today's technical briefing. Over to you, Dr. Njoo.
Okay, thank you very much. Merci, Eric. Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Brigadier-General Krista Brodie, Vice President of Operations and Logistics at the Public Health Agency of Canada. And to assist us in answering your questions, we have with us Joelle Paquette from Public Services and Procurement Canada. This week, Canada's vaccination campaign has continued to soar. As of today, more than 19.6 million doses have been administered. It is very encouraging to see that over 55% of the eligible adult population in Canada has rolled up their sleeves. As of May 16th, there have been 34 reports of blood clots with low levels of blood platelets following immunization in Canada with the AstraZeneca or Provincial vaccines reported to the federal level. Of those, 21 have tested positive for PF4 antibodies, meeting the definition of vaccine-induced immune thrombotic thrombocytopenia or VITT. Laboratory testing on the remaining 13 individuals is ongoing. We continue to take these reports of side effects to vaccines, however rare, very seriously, and we consider these carefully when looking at the vaccine portfolio in Canada. Earlier this week, after Health Canada's authorization on May 5th of the use of the Pfizer-BioNTech COVID-19 vaccine for youths aged 12 to 15, the National Advisory Committee on Immunization, or NACI, recommended that youths 12 years of age and older without contraindications be offered a complete series of this vaccine based on clinical trials of the vaccine in this age group. It is up to the individual provinces and territories to decide when and how to incorporate this age group into the vaccine rollout, and many have already begun to do so. Vaccinating younger populations will help protect them, control the spread of COVID-19, and contribute to even broader vaccine coverage across the country. In addition, this week, Health Canada authorized the Pfizer-BioNTech vaccine to be safely stored at regular refrigerated temperatures, that is 2 to 8 degrees Celsius, for up to 1 month. This change will help make vaccine distribution more flexible and may allow for wider distribution, ultimately getting even more doses into arms even more efficiently. I know we're all encouraged by recent developments like these. We can clearly see Canada's vaccination efforts expanding and accelerating in a big way. More than ever, we're looking forward to being able to safely gather with our friends and families and regaining some sense of normalcy. As detailed last Friday when we talked about public health measures post-vaccination, these better days and the gradual lifting of restrictions may be just around the corner if we keep up our good work. I thank Canadians for all the good work they've already done, and I ask everyone to keep going. For now, though we may be tempted this long weekend, we must continue physical distancing, wearing our masks, and following local public health advice, regardless of our vaccination status. Let's stay on track and keep case counts down so we can all have the safe summer we want. Thank you. Bonjour à tous et à toutes et merci de votre présence à la séance d'information technique d'aujourd'hui sur la vaccination contre la COVID-19 au Canada. Je suis accompagné de Madame le Brigadier-Général Krista Brodie, vice-présidente des opérations de la logistique à l'Agence de la santé publique du Canada. Joelle Paquette, de Services publics et approvisionnement Canada, est avec nous pour nous aider à répondre à vos questions. Cette semaine, la campagne de vaccination contre la COVID-19 au Canada a poursuivi sa montée en flèche. En date d'aujourd'hui, plus de 19,6 millions de doses de vaccins ont été administrés. Il est encourageant de constater plus de 55% de la population adulte admissible au Canada a déjà retroussé la manche. En date du 16 mai, 34 cas de caillots sanguins combinés à un faible taux de plaquettes sanguines suivant l'administration du vaccin d'AstraZeneca ou de vaccin Provincial au Canada ont été signalés à l'échelon fédéral. Parmi les personnes touchées, 21 ont reçu un résultat positif pour les anticorps anti-PF4 répondant ainsi à la définition de thrombocytopénie thrombotique immunitaire induite par le vaccin ou TTIV. Pour ce qui est de 13 personnes restantes, l'analyse en laboratoire est en cours. Nous continuons de prendre très au sérieux ces signalements d'effets secondaires liés au vaccin, aussi rares soient-ils, et nous en tenons bien compte quand vient le temps de constituer l'arsenal de vaccins du Canada. Le 5 mai, Santé Canada a approuvé l'utilisation du vaccin Pfizer-BioNTech contre le COVID-19 chez les jeunes de 12 à 15 ans. À la lumière de cette approbation, le Comité consultatif national de l'immunisation, ou CCNI, a recommandé en début de semaine de proposer la série complète de ce vaccin aux jeunes de 12 ans et plus, sauf en cas de contre-indication. Cette recommandation est fondée sur les résultats d'essais cliniques centrés sur ce groupe d'âge. Il revient à chaque province et territoire de décider quand et comment intégrer ce groupe d'âge dans sa campagne de vaccination et beaucoup ont déjà commencé à le faire. La vaccination des jeunes permettra de protéger ce groupe d'âge, de contrôler la propagation de la COVID-19 et de renforcer la couverture vaccinale dans tout le pays. De plus, Santé Canada a approuvé cette semaine, à la demande de Pfizer-BioNTech, la conservation du vaccin à des températures normales de réfrigération, c'est-à-dire de 2 à 8 degrés Celsius, pendant une période pouvant aller jusqu'à un mois. Ce changement rendra la distribution des vaccins d'autant plus adaptable, voire plus large, ce qui veut dire que nous finirons par pouvoir vacciner encore plus de gens encore plus efficacement. Je le sais, de récents développements comme ceux-ci sont une source d'encouragement pour nous tous. Il est très évident que la vaccination au Canada s'étend et s'accélère à grands coups. Plus que jamais, nous pouvons entrevoir un avenir où nous pourrons nous rassembler en famille et entre amis en toute sécurité et reprendre une vie plus normale. Comme nous l'avons précisé vendredi dernier lorsque nous avons parlé des mesures sanitaires après la vaccination, ces jours meilleurs et la levée graduelle des restrictions pourraient être pour bientôt. Si et seulement si nous continuons sur notre lancée. J'en profite pour remercier les Canadiens et Canadiennes de l'excellent travail qu'ils ont déjà accompli et je prie tout le monde de ne pas lâcher. Pour l'instant, même si la tentation de faire le contraire sera forte pendant la longue fin de semaine qui s'en vient, nous devons encore respecter la distanciation physique, porter le masque et suivre le conseil de nos autorités de santé publique locales, que nous ayons été vaccinés ou non. Il faut maintenir le cap et ne pas laisser augmenter le nombre de cas si nous voulons avoir le bel été que nous souhaitons tous. Merci. Et maintenant, je cède maintenant la parole à Madame le Brigadier-Général Krista Brodie. Merci.
Good afternoon. I'm Brigadier-General Krista Brodie, Vice President, Logistics and Operations at the Public Health Agency of Canada. It's an honor for me to return to the agency. This organization has momentum. We are very much in the big lift. We are increasingly seeing high volume vaccine supply with a record number of vaccine deliveries this week. The National Operations Center is humming along like a well-oiled machine. Collaboration with provinces, territories, Indigenous communities, and other government departments has set a solid foundation for the efficient distribution of vaccines across the country. It has set the conditions for success as we begin to operate at scale. These relationships are important as we position to receive vaccine doses in the millions on a regular basis. This week is a big week for vaccine supply. Over 2 million Pfizer-BioNTech vaccine doses have gone out in the past 3 days alone. Another 1.4 million doses of Pfizer-BioNTech are being distributed today and tomorrow, ahead of schedule, in advance on next week's deliveries due to the upcoming holiday on Monday. The remaining 600,000 doses, scheduled for the week of May 24th, are due in shortly after Victoria Day. For Moderna, today, we received 1.1 million doses that will be delivered to provinces and territories between now and Saturday. We continue working with the manufacturer on upcoming delivery schedules. We have also completed delivery of 534,000 doses of AstraZeneca this week. We are focused on the goal and will keep working tirelessly to provide vaccines to Canadians. We are an integrated team of public servants and CAF professionals, resilient, agile, and completely committed to the mission of COVID-19 vaccine mobilization. In a single week, we will have surged from 20 million to over 25 million doses delivered across the nation. We are on track to deliver more than 40 million doses to provinces and territories by the end of June. It is a significant milestone. I'm proud to be back with the team and to play this small part in supporting such a monumental effort. Bon après-midi. Je suis le Brigadier-Général Krista Brodie, vice-présidente de la logistique et des opérations à l'Agence de la santé publique du Canada. C'est un honneur pour moi de revenir à l'agence. Cette organisation a du vent dans les voiles. Nous sommes dans la grande poussée. Nous constatons de plus en plus un volume élevé de vaccins, avec un nombre record de livraisons de vaccins cette semaine. Le Centre national des opérations bourdonne comme une machine bien huilée. La collaboration avec les provinces, les territoires, les communautés autochtones et d'autres ministères a établi une base solide pour la distribution efficace des vaccins dans tout le pays. Elle a établi des conditions de succès alors que nous commençons à fonctionner à grande échelle. Ces relations sont importantes, comme nous nous apportons à recevoir des millions de doses de vaccins sur une base régulière. Cette semaine est une semaine importante pour l'approvisionnement en vaccins. Plus de 2 millions de doses de vaccins Pfizer-BioNTech ont été envoyées au cours des 3 derniers jours. Nous distribuerons encore 1,4 million de doses de Pfizer-BioNTech aujourd'hui et demain, en avance sur le calendrier, en avance sur les livraisons de la semaine prochaine, en raison de jours fériés de lundi. Les 600 000 doses restantes, prévues pour la semaine de 24 mai, seront livrées au Canada après la fête de la Reine. Quant à Moderna, nous avons reçu aujourd'hui 1,1 million de doses qui sont en cours de livraison aux provinces et aux territoires. Nous continuons à travailler avec le fabricant sur les prochains calendriers de livraison. Nous avons terminé la livraison de 534 000 doses d'AstraZeneca cette semaine. Nous sommes concentrés sur l'objectif et nous travaillons sans relâche afin de livrer les vaccins aux Canadiens et Canadiennes. Nous sommes une équipe intégrée de fonctionnaires et de professionnels des Forces armées canadiennes, résilientes agile et totalement engagé dans la mission de mobilisation des vaccins COVID-19. En une seule semaine, nous serons passés de 20 millions à plus de 25 millions de doses livrées à travers le pays. Nous sommes sur la bonne voie pour livrer plus de 40 millions de doses aux provinces et territoires d'ici la fin du mois de juin. Il s'agit d'une étape importante. Je suis fière d'être de retour au sein de l'équipe et de jouer un petit rôle dans le soutien d'un effort aussi monumental. Merci.
Thank you, Brigadier General Brodie. We will now open the phone line to questions. Please limit yourself to one question and one follow-up. We'll be taking your questions in both official languages. Nous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une des deux langues officielles. Opérateur, over to you.
Thank you. Merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, la première question, David Thurton, CBC News. Your line is open. À vous la parole.
Hi. I think this question is for Brigadier General Brodie, but Dr. Njoo, feel free. When will Canada have enough supply to accelerate second doses more aggressively and move beyond the one-dose strategy that is in place right now? And if you can respond in French, please, en français, that would be much appreciated.
It's Dr. Njoo. Maybe I'll just start off to say, maybe to reframe your question. Canada does not have, quote, a one-dose strategy. We've always had the two-dose strategy. The issue, I think, obviously has been about sort of extending the dose interval between the first and second doses. So I think with obviously millions more of doses coming into the country very quickly, I think we're well on track to offer that second dose. Obviously the interval has been up to, the 16 weeks, but certainly can be a lot less. And I'm certainly starting to see that in many of the provinces and territories where they're booking. So I think we're on track to, as I say, shorten the interval, depending obviously on the supply. But I think I would just leave it at that and pass it on to Brigadier General Brodie to respond as well. Thank you.
Thank you. I'd offer that we continue to push vaccines to the provinces and territories as soon as they become available in accordance with the allocations to allow the provinces and territories to roll out their vaccine campaigns in the manner that they determine best meets their population needs. Donc, on est en train de mettre l'accent pour faire avancer la distribution des vaccins vers les provinces et les territoires pour qu'ils puissent dérouler leur programme de vaccination pour s'assurer que la plupart des Canadiens peuvent accéder les vaccins plus tôt que possible.
Merci. Juste parce que vous voulez que je répète ma réponse en français aussi. Je pense que notre approche ici au Canada, c'est toujours d'administrer les vaccins qui ont besoin des deux doses. C'est toujours la stratégie. L'enjeu était l'intervalle entre les deux doses. On a suivi dans toutes les provinces et territoires les recommandations de CCNI de peut-être un peu allonger l'intervalle jusqu'à 16 semaines, 4 mois, mais avec les millions de doses qui sont en train d'être livrées ici au pays, je pense que au fur et à mesure, les provinces et territoires sont peut-être capables de donner la deuxième dose aux Canadiens et Canadiennes peut-être plus tôt que l'intervalle jusqu'à 16 semaines. Ça va bien, je pense, que pour l'été à venir.
Thank you. Follow-up question?
Yes. So Quebec is introducing an adequately vaccinated category, people who have had COVID and who will now be getting who have had COVID and will now be getting just one dose. What are your thoughts on this? And is this the direction we should be heading in? Can you also respond in French as well?
Okay, thank you for the question. It's Dr. Njoo. I think I'll take that one since it's a bit scientific and public health oriented. So, yes, we're well aware of what Quebec is pursuing. There is some evidence experience in other countries, but I would say that it's based primarily on sort of what we know with respect to vaccinology and immunology. And the fact is that if you do have natural infection, obviously your body does mount an immune response. And so I think the thinking in Quebec is that by having received, by having had that natural infection, in some ways, it's like getting a first dose of a vaccine, which obviously is a different way of challenging or exposing the body to this virus. Obviously, a vaccine is not the virus itself; it's the spike protein, et cetera, and so on. So, with that, then by giving that one dose, in essence, the thinking would be that it would be sort of that second dose in a way of sort of priming again or sort of re-challenging the body with that first dose of vaccine, which in some ways is sort of that second sort of introduction or challenge to the immune system. So that's the thinking. I'm not aware that any other province or territory is also considering that. Certainly, the current recommendation from NACI, based on their analysis of the evidence, is that people should complete a two-dose series of the vaccine, even if they have had COVID-19 previously. But as we all know, and we've said repeatedly, science continues to evolve. Data continues to come forward from throughout the world with respect to the experience in other countries. And I think NACI and experts will certainly be live to looking at data and obviously adjusting any recommendations as appropriate in the future. Je pense en français. Je pense que l'approche au Québec avec le vaccin, c'est que pour les gens qui ont déjà subi une infection, comme dit, naturelle, en effet, ça c'est déjà ça peut activer, comme dit, le système immunitaire. Donc, si on donne une première dose de vaccin, en effet, c'est une autre stimulation le système immunitaire du corps. Donc, l'approche, c'est que, OK, on a sûrement besoin d'une dose de vaccin parce qu'en effet, c'est comme une deuxième dose pour une personne qui n'a pas eu une infection naturelle. On a besoin des deux doses de vaccin, mais pour une personne qui a déjà eu une infection naturelle, une dose de vaccin, c'est comme la deuxième dose. C'est une approche. Il y a peut-être un peu d'évidence aussi à l'expérience dans les autres pays, mais jusqu'à date, les autres provinces et territoires continuent de suivre les conseils, les recommandations du CCNI, et c'est-à-dire donner les deux doses au complet à toutes les personnes, même les personnes qui ont déjà eu l'infection naturelle. Mais comme on sait toujours, la science continue d'évoluer et toujours avec les données probantes qui sortent des autres pays avec leurs expériences. Les experts, incluant le CCI, ils sont toujours prêts à suivre les données probantes. Et si on a assez de données probantes, que c'est peut-être c'est peut-être quelque chose, on peut modifier les recommandations futures.
Merci, Dr. Njoo. Opérateur, prochaine question. Next question.
Thank you. Merci. Our next question. La prochaine question, Hélène Buzetti, les coops de l'information. Your line is open. À vous la parole.
Oui, bonjour. J'imagine que ça s'adresse à Mme Brodie. C'est concernant le vaccin AstraZeneca. Donc, je sais qu'on reçoit à peu près 1 demi-million de doses, mais bientôt, j'aimerais savoir, on en recevra combien d'ici la fin juin, donc d'ici la fin du deuxième trimestre? Et est-ce que ce sera suffisant pour offrir une seconde dose à tous ceux qui ont reçu AstraZeneca en première dose?
Merci.
Ah, vas-y.
Je peux commencer après. Donc, je peux confirmer qu'on a distribué plus de 500 000 doses d'AstraZeneca cette semaine. Il reste encore 100 000 dans notre entrepôt fédéral et on peut confirmer qu'on va vers toutes les mesures nécessaires pour s'assurer que tous les Canadiens qui veulent avoir l'AstraZeneca pour leur deuxième dose va avoir cette type de vaccin. Joelle, à vous.
Oui, merci pour la question. En ce qui concerne le nombre de doses qu'on devrait recevoir d'ici la fin juin, présentement, nous travaillons avec AstraZeneca sur leur entente bilatérale et nous nous attendons d'1 million de doses d'ici la fin juin. Merci.
Et c'est Dr. Njoo, peut-être peut ajouter peut-être une perspective de la santé publique. On sait ici au Canada, jusqu'à date, environ 2,1 millions de Canadiens ont reçu une première dose de vaccin AstraZeneca. Donc, je pense qu'on continue à planifier d'offrir tous les Canadiens qui ont reçu la première dose de vaccin AstraZeneca leur deuxième dose. Mais on sait que peut-être il n'y a pas tout le monde qui peut-être qui ont reçu la première dose, qui peut-être veut avoir deuxième dose. Même si le risque est minime, on sait c'est quoi exactement la situation. Et on sait aussi qu'il y a des études qui sont en cours. On attend avec impatience les résultats des essais cliniques au Royaume-Uni, aussi dans les autres pays. Et le CCNI est prêt à analyser les données probantes. Et je pense que peut-être on peut avoir les recommandations de CCNI même peut-être la première semaine de juin. Et c'est vraiment pour faire des recommandations. Est-ce que c'est efficace et sécuritaire peut-être d'offrir un autre type de vaccin pour les personnes qui ont reçu déjà une première dose de vaccin AstraZeneca? Merci.
Bon, juste me confirmer, parce que ça a coupé, là, vous dites qu'il y a 100 000 doses en entrepôt. Confirmez-moi ça, mais ma question de suivi est la suivante. Donc, 2,1 millions de gens ont reçu AstraZeneca en première dose. Et là, vous nous parlez de 500 000 qui ont été distribués, 1 million à venir, plus, si j'ai bien compris, 100 000 en entrepôt, ce qui fait un total de 1,6 million. Alors, il manquerait encore un demi-million de doses pour permettre à tous ceux qui ont reçu AZ de le recevoir en deuxième dose. Alors, est-ce qu'on prévoit d'autres livraisons pour arriver au moins à ce total de 2,1 millions de dollars, 2,1 millions de doses? Et de manière générale, essaie-t-on de continuer à recevoir des doses de AZ, les 20 millions qu'on était supposé de recevoir dans les prochains trimestres? Merci.
Merci pour la question. Nous avons une entente bilatérale avec AstraZeneca pour les 20 millions de doses. La livraison d'1 million, c'est la première livraison. Nous avons aussi des livraisons qui arriveraient au mois de juillet, mais pour l'instant, nous travaillons avec AstraZeneca pour confirmer la date de livraison au mois de juin. Et par la suite, nous allons continuer de recevoir des doses d'AstraZeneca. Nous comprenons aussi que la situation évolue et nous continuons de surveiller et évaluer les besoins futurs du Canada. Je ne sais pas si un de mes collègues veut donner plus d'informations, mais en ce qui concerne les doses, le nombre de doses, on s'attend à d'autres doses passer le mois de juin. Merci.
Nous allons passer à la prochaine question. Operator, next question.
Thank you. Merci. Our next question, Mia Rabson, the Canadian Press. Your line is open. À vous la parole.
Hi. Yeah, I'm wondering if you could talk about the deliveries of AstraZeneca to the provinces. We got 655,000 doses in the country. So I'm wondering if any provinces said they didn't want any doses, if some said they didn't want as many as they would normally get. If you could break down sort of how that, why we still have 100,000 left from that shipment.
Sure, Brigadier-General Brodie here. So certainly all of the allocation has, all of the shipment has been allocated to the provinces. And what that allows them to do is draw against that allocation to best support their vaccination programs. And there is the option with the AstraZeneca to retain a portion of that allocation in our federal facility pending the right timing and the right plan for each of the provinces and territories. So at this point in time, several of the provinces have exercised that option with respect to their own plans, and that accounts for the amount that's currently sitting in our federal depot. Thank you.
Province say they didn't want any doses of that. And I'm also curious, in terms of this new study that Canada is launching, the Immune Task Force launching on mixing and matching, is NACI expected to be able to provide advice before we get Canadian data on this? And when will we get some guidance on when second doses can go forward? I think there's a lot of anxious people wondering what's going to happen.
It's Dr. Njoo. I could maybe answer the question about NACI and the Canadian study. Certainly, the Canadian study is important. It adds to our knowledge base in terms of, as you say, the mixing and matching. But certainly, my understanding is that based on sort of the good trials underway with lots of people involved, both in the UK and from other countries, that will be sufficient for NACI in terms of analyzing the data available and then making recommendations. And I think. As I said, I think probably in French just a few minutes ago that we're tracking for NACI to maybe give a recommendation or guidance with respect to the mix and matching, probably sort of early June, first week or so. But obviously, with Canadian data and Canadian studies and other studies that might also be undertaken in other parts of the world, that'll also, I think, be taken into account as they unfold and more data becomes available. So certainly, I think as we've seen. Science continues to evolve, and I think we need to follow the science in terms of data as it becomes available. Thank you.
Thank you very much.
Brigadier-General Brodie here. The first part of your question was partially. The first part of your question was partially cut off, but we confirm that our practice is for those provinces that indicate that they're not able to use the full measure of their apportionment, then we can make arrangements to shift those allocations between provinces to ensure that as many Canadians as possible can benefit from the allocations that we do have. Thank you.
Thank you very much. Operator, next question. Prochaine question.
Merci. La prochaine question, Geneviève Normand, CBC Radio-Canada. Your line is open. À vous la parole.
Oui, merci de prendre ma question. La première s'adresse à vous, Dr. Njoo. En fait, c'est à propos de la frontière. À quand voyez-vous l'assouplissement des mesures à la frontière canado-américaine, mais les frontières internationales en général, par exemple, pour les gens qui veulent rentrer au Canada, qui ont déjà reçu les 2 doses du vaccin à l'étranger, par exemple. Alors, à quand est-ce que vous pensez sur le plan sanitaire que ça peut être assoupli? Et une réponse en anglais aussi serait appréciée.
Merci. Merci pour la question. C'est un enjeu actuel, c'est sûr, et on continue d'examiner les données probantes. Il y a toutes sortes d'aspects, même techniques, parce que même après la vaccination, on sait qu'il n'y a aucun vaccin qui est 100% efficace. Qu'est-ce qu'on fait avec peut-être les personnes qui restent encore susceptibles, même après 2 doses de vaccin? Aussi, des autres questions, c'est quoi la durabilité de l'immunité, de la protection contre la COVID-19? Il y a toutes sortes d'aspects comme ça, mais je pense que on est, comment dire, encouragé par la situation ici au Canada, mais aussi aux États-Unis avec l'épidémiologie, mais aussi, comment dire, le déploiement des vaccins dans les 2 pays. Je pense que c'est les autres aussi. Je pense que les ministres qui sont en train d'avoir des négociations. Moi, avec Dr. Tam, les autres, on donne toujours nos conseils, recommandations avec une perspective de la santé publique, mais on sait que si on parle de l'ouverture de la frontière entre le Canada et les États-Unis, il y a aussi des autres considérations, pas seulement la perspective de la santé publique. In English, the whole issue of opening up the border with the United States, I think obviously it's a very live issue. From a technical public health perspective, we're certainly looking at the data. I think it looks very good in terms of the situation, epidemiologically, but also in terms of vaccine rollout, both in the United States and in Canada. However, to be quite honest, there are some technical questions, unanswered scientific questions. with respect to Canadians who might have their 2 doses of vaccine and what could or should happen to them when they come to Canada. Obviously, there's a sort of a quarantine regime in place right now. The fact is, we know that there's no vaccine that's 100% effective, and so even with people receiving 2 doses, a certain percentage will come through and still be susceptible, maybe still be able to transmit and so on. And then, of course, even the question of durability. How long does immunity last, et cetera, and so on. So there's some technical questions, but beyond that, I think certainly the role of myself, Dr. Tam, and others is to give our best advice, the public health perspective to our minister and cabinet. But as we know that the issue of opening up the border with the United States, there are other considerations beyond just purely technical public health. So I think I'll just leave it at that. Thank you.
Très bien, merci. Tout à l'heure, ma collègue vous a parlé du vaccin d'AstraZeneca. Moi, je voudrais vous parler du vaccin de Moderna. Vous avez dit tout à l'heure, la Brigadier-General Brodie, vous avez dit que nous continuons à travailler avec le fabricant pour les prochains calendriers de livraison. Mais sauf erreur, il me semble que ça fait plusieurs fois qu'on attend justement des nouvelles avec Moderna. Alors, qu'est-ce qu'il en est? Est-ce que, par exemple, il y a une possibilité qu'on puisse avoir une entente avec un fabricant américain pour recevoir des vaccins de Moderna? On en est où dans les négociations, dans tout le travail qui se fait dans l'ombre? Again, in English would be great too.
Donc, je peux commencer en confirmant que cette semaine, on a reçu 1,1 million de doses ce matin et on est en train de les livrer aujourd'hui, demain et le samedi aussi. Et on est en train de continuer nos communications avec le manufacturier pour confirmer la prochaine livraison. Joelle?
Merci. Oui, comme Général Brodie a mentionné, on continue à travailler avec Moderna sur son calendrier de livraison. C'est certain que notre objectif, c'est de recevoir le plus de doses possible au Canada le plus vite possible. Et pour ce faire, on travaille avec eux afin d'obtenir des doses de leur chaîne logistique mondiale. Donc, s'il y a des possibilités, on l'explore et on va y aller de l'avant. In English is we're continuing to work with Moderna on their delivery schedule and firming up that delivery schedule. The objective is really to get as many doses in Canada as soon as possible, and we're working with them and other suppliers on their global supply chain, if available. Merci. Thank you.
Dr. Njoo, I was just thinking about the answer I was giving before. And so, to the question about, Canadians, with 2 doses of vaccine, could or should they be allowed in, et cetera, and so on. I think a lot of it also depends on sort of where we are with our vaccine coverage in Canada, because it's not so much about individuals who might be coming into Canada from abroad, what their vaccination status is. It's about how comfortable we are in terms of is the situation controlled in Canada with the epidemiology, as well as the vaccine coverage. Do we feel that our population as a whole is well protected? And that's why we've been talking about that 75% goal in terms of 2-dose coverage in Canada. Hopefully, even more will have received the vaccine. So those are some of the factors in play as well, besides the other considerations. So I'll leave it at that. Thank you.
Our next question. Prochaine question.
Thank you. Merci. Our next question, Mike Lacuter, Global News. Your line is open. À vous la parole.
Yes, hi. This might be for Brigadier-General Brodie. I wanted to ask you, how many doses of the AstraZeneca vaccine are at risk of expiring either at the end of May or June? And what are you going to do with them? Will they go to waste, or will you make sure that they get sent to other countries and or provinces?
At this point, we're tracking a very small number of doses that will expire at the end of May, and we're working actively with the provinces to ensure that they can be used in a jurisdiction that has the capacity to administer those before their expiry date. The remainder of the AstraZeneca doses that were distributed this week have an expiry towards the end of August, so the provinces have ample opportunity to work those into their distribution plans, into their vaccination campaigns. And if vaccines do time expire, then then we will dispose of those in accordance with Health Canada and public health best practices, monitor that wastage while making every effort to ensure that as many vaccines as possible are used to vaccinate Canadians.
Thank you,
Sorry,
Joelle.
I just want to get a precise number on the small amount when you said a very small amount, but also for my follow-up, I think it's more for Dr. Njoo, following up on a question of my colleague. Many people are waiting for that guidance on the dose mixing, especially when it comes to the second dose of AstraZeneca. Will it? I know you said maybe at the beginning of the month, but this is also at a time when we are looking at expiring AstraZeneca vaccine. So how worried are you that the lack of any kind of guidance is contributing to this vaccine hesitancy and then possibly contributing to vaccine wasting?
I can't really speak to, thank you very much for the questions, Dr. Njoo. I can't really speak in terms of sort of the vaccine wastage. Obviously, that's a logistical administration issue with respect to the vaccination programs in the individual provinces and territories. What I can say is that, let's focus on the AstraZeneca vaccine and those Canadians who have received that first dose. We've said it before and I'll repeat it. I think, they've done well. They've obviously protected themselves by getting the vaccine. They've protected their family and their loved ones. And I think they've contributed overall to what we say our collective sort of herd immunity and decreasing the risk of further community transmission. With respect to getting the second dose, if you look around the world, especially in the United Kingdom, millions of people have received a full 2-dose regime of the AstraZeneca vaccine. And so I think, if you look at that, it's always a matter of, I would say, a sort of a full information, full informed consent, and in some ways a personal risk tolerance. So you look at the fact that millions of people have received it. It's fine with a 2-dose regime. Here in Canada, obviously, we're alive to the issue, and you've seen it in other countries as well as here, that there is this rare event. It's rare, but if it does occur, it is serious with the blood clots. And so that's why the provinces, because there is, I guess, in some ways, another option with the mRNA vaccines. They put a pause in terms of the first dose of the AstraZeneca vaccine. So what I would say is that, individuals, I can't speak for the provinces in terms of how they're offering potentially that second dose under which interval. But I think that's certainly one option. And I guess for those individuals who have received the AstraZeneca vaccine, they may well have a second option, which is hopefully forthcoming with a recommendation from NACI with respect to, say, mixing and matching. All I can say at this point, looking at the sort of the preliminary results from studies around the world, especially from the UK, that the early results from what I've seen are very promising. So I think it bodes well for individuals who have received the first dose of AstraZeneca, having that choice. And of course, at the end of the day, it comes down to making an informed decision.
Thank you, Dr. Njoo. Operator, next question, prochaine question.
Thank you. Merci. La prochaine question, Catherine Lévesque, La Presse canadienne. Your line is open. À vous la parole.
Oui, bonjour à vous tous. Je voulais revenir sur une question qui avait été posée par ma collègue Mia Rapson. Je me demandais, je pense que c'est Brigadier-Général Brodie qui va pouvoir répondre. Je me demandais si vous pouviez nous donner une liste des provinces qui ont demandé en fait à recevoir les 655 000 doses de COVAX. Et je ne sais pas si vous pouviez aussi nous donner les chiffres approximatifs, combien de doses ont été envoyées à chacune de ces provinces. Merci.
Je n'ai pas les numéros précis à mes droites maintenant, mais les tables d'allocation sont dans le domaine public sur canada.ca. Et donc, le tableau pour AstraZeneca indique les allocations pour chaque province. Merci.
Ah, OK. Ça semble être une nouvelle parce qu'on fait la demande à l'Agence de la santé publique et on n'a pas la réponse. J'avais une autre question. Je ne sais pas si c'est Dr. Njoo qui pourra y répondre, là, mais c'est au sujet d'un autre vaccin là, dont on n'a pas entendu parler depuis longtemps, celui de Johnson & Johnson. Qu'est-ce qui se passe avec les 300 000 doses qui sont toujours sous étude? Et est-ce que c'est normal que ça prenne autant de temps avant d'avoir une réponse là, sur ces doses-là? Merci.
OK, merci pour la question. Oui, c'est une bonne question. Ce que je peux vous dire que c'est ce que je sais que c'est Santé Canada qui est en train encore d'analyser les données probantes, et continue aussi d'avoir des discussions avec les fabricants aussi, avec les homologues aux États-Unis. C'est tout ce que je peux dire parce que je suis au courant avec d'autres renseignements. Donc, je pense qu'il continue le travail. On attend une décision bientôt.
Merci beaucoup. Operator, next question. Prochaine question.
Thank you. Merci. Our next question, Marieke Walsh, the Globe and Mail. Your line is open. À vous la parole.
Good afternoon. My question is for Brigadier General Brodie. You mentioned in your opening comments that Canada is expecting to receive more than 40 million doses by the end of June. Previously, we've been told that it's at least 48 million doses. So can you please specifically tell us how many above 40 million you're expecting by the end of June, and what is the breakdown between the different types of vaccines in that total delivery by the end of June?
So certainly when we speak to numbers from a distribution perspective, we're talking about either doses that have been delivered or orders that have been confirmed or in the process of the ordering and shipping process. So from a distribution perspective, we can confirm up to 40 million doses by the end of June. That includes this week's deliveries of Pfizer, of Moderna, of AstraZeneca, and it includes the confirmed projections for the Pfizer deliveries between now and the end of June. Thank you.
If I might add,
Thank
on
you.
the projection or expected doses, we're still working with Moderna, as was mentioned earlier, on determining their firm delivery over the month of June. And then we're working with AstraZeneca on 1 million doses by the end of June. Thank you.
Thank you for that extra information. I think my question maybe then for follow-up is both for Madame Paquette and for Brigadier General Brodie. Brigadier General, you just said up to 40 million doses by the end of June, which is, again, different than more than 40 million doses. So, again, can there be more specificity around what we are actually expecting by the end of June? And for Madame Paquette, can you explain a bit more what you're still trying to confirm? Is it now incorrect to say that Canada will receive more than 48 million doses by the end of June?
So I can speak to just those numbers where we have confirmed deliveries in the pipeline, and that'll bring us to around the 40 million point, maybe slightly lower, maybe slightly higher. And should additional natures of vaccines come online as we move through the month of June, and then that will add to that number and continue to push it upwards. Over.
Thank you. I just want to say that from the beginning, our goal has been to have enough doses to vaccinate eligible Canadians by the end of September. And I can say that we're on track to meet that goal. Thanks.
Thank you very much. Operator, next question.
Thank you. Our next question, Charlie Pinkerton, iPolitics. Your line is open. À vous la parole.
Hi. It was about a month ago when the Public Health Agency of Canada disclosed document to one of the parliamentary committees showing that it had conducted a survey of the provinces and territories to see how many vaccine doses they were actually capable of delivering on a weekly basis. The number there was 3.1 million, which we're going to surpass pretty quickly. We have as of this week and every week going forward, at least for the next month, it seems like Canada will receive more than that amount of doses. So I'm wondering, is that number still accurate? Perhaps this is a question best for Brigadier General Brodie or Dr. Njoo, but is that number still accurate for what you know that the provinces and territories are actually capable of administering in a week, or are we going to, or are they able to do more at this point?
Brigadier General Brodie here. I'd offer to start that the provinces and territories continue to build their capacity every single day, their capacity to conduct immunizations, to rally healthcare practitioners, to support those efforts, to project their immunization efforts further and further into the communities. So certainly they have ample capacity and continuing capacity to roll out the vaccination campaigns across the country. And we continue to work to make sure that they have the ancillary equipment, the cold chain equipment that they require to continue scaling up as vaccine supply becomes more and more available.
Yeah, and it's Dr. Njoo. Maybe I can just add to that. I think it really speaks to, I think, the wonderful sort of innovation and inventiveness by, I think, the provinces and territories. You know, there's been all sorts of things we've seen in news. You know, pop-up clinics, clinics at night. All sorts of wonderful ways that drive-by clinics, etc. So that it's amazing. How provinces have been innovative in terms of offering and increasing their capacity, and even in terms of human resources, the vaccinators. I think there was a certain sort of workforce that we thought we start with in terms of be it nurses and so on, but more and more people have become trained as vaccinators. So that's on the one side, and I think it also speaks to the demand. So that's great. Canadians are hungering; they want they're thirsting for their vaccine doses. So I think the fact that provinces and territories are upping their games in terms of capacity to deliver vaccines, and there is actually the demand to get the vaccines, I think speaks well for everyone in terms of our vaccination effort. Thank you.
Thank you. Follow up?
Yeah. So how many vaccine doses per week then are you aware that the provinces and territories are capable of delivering at the moment? Or administering, rather, sorry.
I'm not sure Brigadier General Brodie has more exact figures. I've got obviously the total figures of vaccine doses administered. I don't know if I have the breakdown in terms of provincial weekly sort of administration data. That obviously changes. I think even a week to week. As more doses roll in, and the provinces and territories continue sort of to enhance their capacity. But certainly we can look at what data is available sort of afterwards, and certainly provide you with what we have at the federal level.
That would be appreciated.
And I think that the provinces and territories would be pleased to speak about their own capacities and efforts to scale up their administration capacities. From a distribution perspective, we're really focused on distributing as many vaccines as we have available that come available to the Canadian population, and distributing those in a manner as effectively, as efficiently, and safely as possible, so that they can be administered to Canadians.
Thank you very much. We have time for one last question. Dernière question, opérateur.
Thank you. Merci. Our last question, la dernière question. Rachel Haynes, CTV News. Your line is open. À vous la parole.
Hi there. I'd just like to follow up on what my colleague Marika was asking about why we're no longer able to confidently say that we're going to be getting 48 million doses. Has something changed with the shipments or with the manufacturers? Is it Moderna that's not meeting its commitments that is forcing us to no longer meet that 48 million target?
Thank you for the question. In mid-April, we did report that Moderna was expecting Canada would see disruption of its deliveries as the company was working on scaling up production capacity. And right now, we're working with Moderna to firm up their delivery schedule, and we will be able to provide further detail once we have a better confirmation of their delivery capacity on a weekly basis. Thank you. Or on when we know when the next delivery arrives. Thank you.
Thank you. And my follow-up question is to Brigadier General Brodie. This is your first appearance in your new role at Public Health Canada. Obviously, after Major General Dany Fortin had stepped aside. So I would just like to know, how are you feeling in taking over in his role, given the circumstances of his departure and also in the overall context of what's happening in the higher ranks of the military?
Thank you. So I'm feeling many things. So I'm feeling excited for the opportunity to be able to lead a logistics organization as they are involved in such a monumental effort on behalf of Canada and Canadians. I'm honored to be working with the team here again. And I think I would like to acknowledge that in these times, there are many, many things that we need to be doing within the Canadian Armed Forces and within society at large to ensure that our behaviors, our attitudes, our beliefs align with the better values of the profession, align with the values and the ethical principles that we uphold as Canadians, and that we make every effort to advance those efforts to ensure that we are being the best Canadians we can be in every facet of our lives. Thank you.
Thank you, Brigadier General. That will be all for today's technical briefing. C'est ce qui met fin au briefing technique pour aujourd'hui. Bonne journée.
Thank you. Merci.